I think it's important to define what types of hair loss there are. And so these are some of the major types of hair loss. If we could summarize the most common kinds of hair loss, this is it. The first one, known as telogen effluvium, can be acute or chronic. And this is generally hair loss that occurs where it's less about big patches or swaths of hair coming out, and it's more about the thinning of the hair. The hair is not growing in as quickly. You have shedding happening more aggressively, and so overall the hair, the thickness, the fullness is being reduced. And so that's, this is just the doctor terminology, the fancy way of saying thinning of the hair leading to a less robust and thick, vibrant head of hair. And then we have what's called androgenetic alopecia. This type of hair loss is typically referred to as male pattern, but there's also female pattern loss. And so this is largely hormonally related. We'll get into some of that here shortly. But if you have, for example, guys, if you've got a receding hairline and you're in your late 20s, this is most likely an androgenetic type of alopecia created by hormonal changes. Same thing, ladies. So, and then we have alopecia areata. And alopecia areata is a form of autoimmunity. So this is one of those, you get, a lot of times people go to the doctor and they have these big patches of hair loss where the skin itself, the hair follicles are being destroyed by an autoimmune process, and you get these big patches of smooth hair loss along the scalp. And it can, usually it's like nummular shapes, so like shaped like almost like a round or oval like shape of hair loss pattern, and it can become patchy all across the head. But alopecia areata can turn into alopecia universalis in some cases, right? This is where the hair loss doesn't stop at the scalp. It spreads over to the eyebrows, and it goes across the body, and it can happen in arms, legs, groin area, everywhere across the body. That's where hair loss is universal across the body. Again, an autoimmune process, and if you've watched me for any length of time, you know that one of the major causes of autoimmune disease is gluten, and we'll get to that again here in just a few minutes. So those are the three primary types of hair loss. Now let's talk about what causes hair loss. There are a number of categorical big things that we're certain of that definitely cause hair loss. And one of them, as I mentioned a minute ago, is gluten. But it's not just limited to gluten. Other food sensitivities can do it as well. I've seen cases where people were allergic to beef, where people were allergic or reactive to some of their favorite foods. And this was a driving force of inflammation leading to inflammatory hair loss. And so gluten and other food sensitivities are a common trigger. We also know that many medications can trigger hair loss. We'll get to that list here in just a minute. I'm going to give you a very comprehensive list of medicines that are known to cause hair loss, because if you're taking them, it's one of the first questions that you want to ask, right, before you assume that your hair loss is some type of fate that you have to deal with. And then we have intense stress or intense events. And one of the most common examples in today's world is this post-COVID hair loss. Now, they're calling it post-COVID hair loss, but honestly, this happens no matter what kind of infection you have. Any infection, whether it's viral, bacterial, if you've got an acute infection, it's hammered your immune system, you're going to have a period of intense hair loss. It's going to play out over 6 to 12 months post the infection. And so a lot of people right now are dealing with this, what we would call post-infectious hair loss. Now, this type of hair loss, coming back here, is this right here, acute telogen effluvium. That's acute, whereas acute is more infectious. Chronic has more to do with inflammation chronically being generated. So again, this is why food allergy is a common cause of telogen effluvium in a chronic fashion, and anything else that can cause chronic inflammation can drive that. And so again, we've got the intense stress events which is commonly, post-infection. But other stressful events can also do this. Somebody loses a loved one. If somebody has a major stressful fracture, breaks a bone, is in a major traumatic accident, has a burn issue where they maybe got burned in a fire. I've seen cases where a person got, burned part of their arm because they were playing around a fire, and that was followed by intense hair loss as a result of that protein loss through the burn. So intense stressful events, whether they're psychological, physical, or emotional, can be triggers. And again, a lot of you, I know that's going to be one of the big questions that we get tonight is, can COVID cause hair loss? And the answer is yes. We'll talk about what you can do about it. Stay with me. We're going to get to that point. I know a lot of you are wondering, okay, I have it. What do I do about it? We're coming to that. And then we have chemical exposures. Now, chemical exposures, again, chronic inflammation, right? So this is inflammatory. Just like gluten can cause inflammation, right? Chemicals can cause inflammation as well. And so those types of exposures, again, damage hair follicles or lead to inflammation in the body that leads to hair loss overall. And then we have nutritional deficiencies. This one's super important. Probably, in my opinion, a lot can be done here that's completely ignored. Doctors ignore it. I mean, how many, raise your hand tonight, and if you're watching the show, how many of you have gone to a dermatologist or to a doctor's office because you were having hair loss, and they gave you kind of this, hey, there's nothing really that you can do in your diet or with nutrition, and instead they wrote you a prescription for a medication or for a hair gel that you could, something you could apply to your scalp, which is very common. Minoxidil is one of the most common prescription medications that are dispensed by doctors, and very, very rarely is nutrition talked about. But you can't grow hair without nutrients, and that's where we're going to go with this conversation. So stay with me. Okay, so those are your major causes. Let's talk a little bit about the medicine. I told you I'd give you a list of medicines that definitely cause hair loss. And as you can see here, these are super common. Like, these are not like these rare esoteric types of medicines that are rarely dispensed. These are dispensed en masse. And sometimes, and some of these are like NSAIDs, for example. This is over the counter, right? So OTC, there's a lot of people take ibuprofen. A lot of people take naproxen or other types of non-steroidal anti-inflammatories for the chronic pain. And if you struggle with chronic joint pain, muscle pain, and you're popping ibuprofen on a regular basis, be prepared. It's a cause of hair loss. How many people in the world today are on cholesterol medications? Right, and there's more than one kind of cholesterol medication. So we're talking here, in this case, we're talking about statins, which are the most commonly prescribed, but we're also talking about a class of medicines called bile acid sequestrants, which actually bind and inhibit your ability to absorb vitamins, right? Particularly fat-soluble vitamins and omega-3 fat, which are all critical for proper hair growth. So again, these medicines can interfere with that process. Most of you may know somebody or a family, a friend, or an acquaintance that's gone through this right here for cancer treatment, chemotherapy, and what happens is their head, they lose all their hair. Why? Because it's a poison. They're injecting a poison into that individual, creating a massive stress on the body that leads to disruption of hair growth, and so they lose all their hair. And generally, once the chemotherapy regimen is over, their hair can start to grow back out. We've got acne medicines, Accutane, which is one of the most common dispensed medicines for acne, contains a synthetic, you should point out it's retinoids, vitamin A. But this is a synthetic vitamin A, can damage your gut, cause leaky gut, can trigger autoimmune problems, but again, hair loss. So you got to be real careful. And I see this in a lot of teenagers, young girls who maybe have some severe acne because they don't want to straighten up their diet. So they go to their dermatologist, they get the drug, the easy way out, and then they end up having hair loss as a result, because there is no easy way out, right? There's never an easy way out when it comes to your body. You have to do the right things to get healthy. Antibiotics can cause hair loss. Anticonvulsants, so if you've been diagnosed with seizures or epilepsy, it's is what anticonvulsives are typically prescribed for. And then antidepressants, drugs for depression, like the SSRI family of medicines. Antifungals. So if you've ever had a fungal infection and been given an azole antifungal, that's an example. Anti-clotting medicines. So if you've had a stroke or been to the doctor and they're thinning your blood, right? Again, these medicines can cause hair loss. Ladies, birth control pills. Or even if we're not talking about birth control pills specifically, we could say hormone replacement. And I see this an awful lot in women going through menopause or early perimenopause, and they're being medicated, they're being over-medicated. Oftentimes, estrogen, they're being way over-medicated. Their doctors are prescribing the estrogen but not measuring it. That's a mistake, because you could be on it and it might be helpful at first, but if you're on it and the dose is not right, you can go and you can become hyperestrogenic, and that is one of the problems that can actually lead to some of that hair loss. So you got to be real careful around estrogen, hormone replacement, birth control pills as well. High blood pressure medicines, one of the most common groupings of meds that are prescribed and dispensed in the U.S. You've got diuretics, you've got angiotensin receptor blockers, ACE inhibitors, all different classes of medicines to treat blood pressure. And as I mentioned here, hormone replacement, that's what HRT is, hormone replacement therapy. Immunosuppressants. Now, immunosuppressants, a lot of different categories here, because one of the types of immunosuppressants are steroids. Another type of immunosuppressant are non-steroidal anti-inflammatories, but some of the ones that are not oftentimes even considered are allergy medicines. Now, how many of you take allergy meds, in the spring or the fall? And some people year-round, right? They take them year-round because they have year-round allergies. Really what they have is a bad diet, but allergy medications are immunosuppressants. They suppress the immune system's ability to produce chemicals, right, to protect you from the environment so that you won't have symptoms, and that can lead to hair loss. Then we have mood stabilizing medicines. So this is people that are maybe bipolar or schizophrenic, and they're taking drugs like Abilify or Geodon that are considered to be mood stabilizing drugs, definitely can contribute to hair loss. And then Parkinson's, so L-Dopa. Parkinson's disease, the common drug given there is L-Dopa. And then steroids, if you've ever taken, steroids like corticosteroids or hydrocortisone, those can cause hair loss. Thyroid medicines. Now, what's ironic here is a lot of women, thyroid medicine is kind of back and forth. It's often, depending on the year, but it's one of the top 5 prescription medicines dispensed in the U.S., period, which is a travesty because most thyroid conditions are not thyroid conditions. Most thyroid conditions are poor diet, right? And if the person knew how to change their diet in the proper way, thyroid problem goes away. But again, doctors aren't trained in nutrition. They don't usually have that conversation. The conversation goes like this: hey, your TSH is too high, your T3 or your T4 is too low, therefore you have low thyroid, therefore you need to be on this drug for the rest of your life. Don't ask me about diet and nutrition. They're not important and they don't play a role. That's nonsense. But overdosing of thyroid, actually 2 people in my office today came in, and not both of them, but in this instance, these 2 individuals that came in today in my office earlier, both of them were being over-medicated. Their thyroid medicine was way too high, and it was pushing their TSH way too low, which is a problem. Why? Because when you overdose, when you take too much, it causes hair loss. When you don't have enough thyroid hormone, it also causes hair loss, right? So it's almost like paradoxical. You could go to the doctor originally with some hair loss. They diagnose you with low thyroid. They put you on medicine, and then your hair starts doing a little bit better, and then you're on that medicine maybe a year, maybe 2 years, and the dose, they're not monitoring it tight enough, and the dose gets too high. You can start having hair loss again. What happens sometimes is they assume, without even testing, they assume that your problem is that you just need more medicine, and so they up your prescription medicine, and the hair loss gets even more aggressive. Again, be aware that not enough thyroid can cause hair loss, but too much can also cause hair loss. And so if you're not aware of that, you can get into that trap. And the weight loss drugs, which I think are total wasted medicine, because weight loss drugs, in my opinion, are just dangerous, and they don't solve a person's problem. They give a person a false sense of hope, but they also can cause weight loss drugs because of appetite suppression, which is one of the mechanisms, can cause malnutrition that leads to hair loss, which is no good, right? We don't want malnutrition, creeping in, because that's not going to solve your problem. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.